And so I found a very interesting study that I thought was interesting. And then I want to kind of go into my own personal anecdote. So there was a survey of 9,161 college students in the United States. And there was a lifetime prevalence of prescription stimulant misuse was roughly 8.1% in this study. And they asked these individuals was like, okay, well, what is your drive to use this stimulant? What are you doing this? And 58% of the individuals said that they were using it for performance enhancement, helping concentration or increasing alertness. The second most frequently cited reason was for recreational purposes, getting a high. So I thought that was really fascinating. If we can, once again, this is only 9,000 college students. I'm not saying this is everyone in the entire world, but it seems like people are more driven to actually use this medication for performance enhancement rather than necessarily like the true abuse that we see with like methamphetamine use disorder, where they use these insane amounts, half a gram a day or something like that. The prescriptions of Adderall is I was listening to a podcast today, tenfold, if not even further, less than that. We're talking about anywhere from 20 to 30 milligrams roughly a day of Adderall. This is much, much less than someone who's using this medication to get high or whatever, right? I've personally related to this. Being that I am a psychiatry resident, I've had to take so many damn standardized tests. And me and you have discussed off air. I feel comfortable discussing myself. I'm roughly in like the 25th percentile of these stupid board exams in medical school. And a big portion of matching into a psychiatry residency at the end of the day is board exams. And whether you like it or not, out of all these professional schools, medical schools, law school, engineering schools, there is ADHD stimulant medication misuse for performance enhancement. And I would honestly kind of argue, like, is that really misuse then? Like these individuals are trying to misuse the medication to perform better on a test. And they're doing this out of not necessarily nefarious reasons, but their own personal interest. They're trying to, maybe get a better job, get into that better school, get into that better residency. So I remember I went to my psychiatric nurse practitioner because I was having some difficulties with focus, and I've always have. I do think it's in part related to my bipolar disorder. Do I maybe meet the criteria for ADHD? I'm not really sure. And so I asked that practitioner at that time in my life, like, hey, look, like, I wonder how I would do with a stimulant medication. I wonder if it would help me with doing better in school. And therefore, in doing better in school, maybe would I feel perhaps a little less depressed? Because at that time, my medical school experience was challenging. There was times where I thought I might fail out of medical school. It's a story for another day. She said, look, you're someone who lives with bipolar disorder type 1. There is a risk if I give you a stimulant medication that this could throw you into a manic episode, which kind of makes sense. There have been even psychotic features when I was manic that could perhaps get brought out by use of a stimulant. I have heard other psychiatric providers have a very different attitude towards someone who has bipolar disorder going on stimulants, or even someone who has like schizophrenia or schizoaffective disorder. Like if you adequately treat their psychosis or their mood features, that person can perhaps tolerate stimulant medication okay, but there's a big risk. So I just thought it's just so interesting that the motivation to sometimes divert this medication isn't necessarily to get high. It's to do better on these tests. And so I would argue, is fixing this problem not necessarily from a medical perspective, but from a social perspective? Do we over-rely on these standardized tests and all these tests in school to make these students do better? Because I get that stimulant medications can help a person perform better on a test, but is it also making them more anxious, maybe more paranoid? Maybe not necessarily to a point where they have to go in an inpatient psychiatric ward, but is it fueling this anxiety that so many people can relate to?
Had a friend in medical school who was using stimulants that were not prescribed to him. Long story short, he had a panic attack, ended up in the ED.
Wow.
Yeah, so it does happen. But, I think about that friend, right? And, I could definitely relate to the pressure that he was under because I was, I was in the same goddamn school. I was going through the same exact situation as him. facing this monster of an exam, USMLE step one. There's a lot of pressure for you to perform really, really well so that you can hopefully match into, the specialty that you want. Right? We're investing hundreds of thousands of dollars into a medical education. And if you don't perform on this test, you may not get to do the job that you've always dreamed of doing. Right? So when you have that reward on the other side, right, there is that inherent motivation to do everything that you can to optimize your efficiency, your ability to learn. And I do think that system inherently places a lot of pressure on medical students, which is why we see sometimes some of our students who may want to potentially use stimulants that are not prescribed to them. So the question I have for you, Logan, is is that really going away? I feel like if anything, it's going to get worse. The population is growing. There's going to be more and more competition for a limited number of spots. With just the way our economy is headed, life is just becoming objectively tougher, right? There's more pressure for you to make more of an income if you want to have the same standard of life that somebody a generation ago did, right? And all these things, I think, places a lot of pressure on students to do everything that they can. And if you see your classmates doing that, if you're in a class of 50 people and 40 other people are taking stimulants, are you at a disadvantage?
And maybe that was the stats that we were up against in medical school. I would love to truly know what the stats were of how many of my colleagues were actually using.
It's not something that people readily disclose, but we know.
Right.
We know what's happening.
Well, and what I would push back against that, obviously in our little bubble of medicine, I do actually think there's an over-reliance on board exams, on MCATs. I think that they have their place, right? Like, you have to have aptitude to do this job. You have to be a certain level of intelligence. I get that. But, man, when in this job is anyone ever sitting down for 8 hours at a time, clicking buttons, getting asked 260 questions in a row? I really think not. Even that neurosurgeon who's doing an 8-hour long, operation, come on, we can develop better testing strategies for individuals like me and you who are, going in this world of psychiatry. I knew I wanted to be a psychiatrist much earlier in my medical training, I think, than you did. It was, day one. Why wasn't there specific testing for me? Why wasn't there specific modalities of testing my interview skills, testing my ability to interact with people? I would think long and hard about how I actually think I could be a more productive, a better psychiatrist if I spent less of my time in medical school learning histopathology and spent time freaking learning Spanish. I think I could do a better job for my patients,